Question 1. A 45-year-old female presents with recent onset of weight gain, fatigue, cold intolerance, and a history of elevated cholesterol. Lab results show elevated TSH and low free T4. What is the most likely etiology of her condition? A. Subclinical hyperthyroidism. B. Primary hypothyroidism due to Hashimoto's thyroiditis. C. Pituitary adenoma. D. Iodine deficiency-induced hypothyroidism. Answer B. Primary hypothyroidism due to Hashimoto's thyroiditis. Rationale: the combination of elevated TSH, low free T4, and symptoms of hypothyroidism, weight gain, cold intolerance, fatigue, suggests primary hypothyroidism, most commonly due to Hashimoto's thyroiditis. Pituitary adenoma can cause secondary hypothyroidism, but the patient's TSH would be low, not elevated. Iodine deficiency is rare in developed countries. Question 2. A 30-year-old woman with a history of hyperthyroidism presents with palpitations, fever, and altered mental status. She is diagnosed with thyroid storm. Which intervention has the highest priority? A. Administer beta blockers to control heart rate. B. Administer antithyroid medications to inhibit thyroid hormone synthesis. C. Administer sodium iodide to inhibit thyroid hormone release. D. Initiate 4 fluids and correct electrolyte imbalances. Answer D. Initiate 4 fluids and correct electrolyte imbalances. Rationale: the first priority in managing thyroid storm is to stabilize the patient with 4 fluids and electrolyte correction due to the risk of dehydration, shock, and arrhythmias. Beta blockers, antithyroid medications, and iodine therapy are important, but secondary to fluid management in the acute phase. Question 3. A 70-year-old patient presents with confusion, bradycardia, and hypothermia. Lab results show extremely low free T4, and TSH is markedly elevated. What is the most likely diagnosis? A. Myxedema coma. B. Thyroid storm. C. Subclinical hypothyroidism. D. Pituitary adenoma with secondary hypothyroidism. Answer A. Myxedema coma. Rationale: myxedema coma is a life-threatening complication of severe, untreated hypothyroidism, presenting with hypothermia, bradycardia, confusion, and markedly elevated TSH. Thyroid storm is characterized by hyperthyroidism, and subclinical hypothyroidism does not present with such severe symptoms. Question 4. A patient is being treated with radioactive iodine for hyperthyroidism. Which of the following is a critical nursing consideration for this patient? A. Ensure the patient is not in close contact with pregnant women or children for a week. B. Monitor for symptoms of hypothyroidism, including cold intolerance and weight loss. C. Encourage the patient to take iodine-rich foods to prevent side effects. D. Monitor for signs of thyroid storm, which can occur in the first 24 hours post-treatment. Answer A. Ensure the patient is not in close contact with pregnant women or children for a week. Rationale: radioactive iodine therapy involves the use of radiation, and precautions are needed to minimize exposure to others, particularly pregnant women and children. Monitoring for thyroid storm and hypothyroidism is important, but not the immediate concern post-treatment. Iodine-rich foods are not recommended during treatment. Question 5. A 60-year-old male with a recent diagnosis of hypothyroidism is started on levothyroxine. After 2 weeks, the patient reports feeling more fatigued and has gained 2 kilograms. His TSH levels are still elevated, and free T4 remains low. What is the next best step in management? A. Increase the levothyroxine dose. B. Switch to liothyronine T3 therapy. C. Perform a thyroid ultrasound check for thyroid nodules. D. Recommend lifestyle changes to address weight gain. Answer A. Increase the levothyroxine dose. Rationale: persistent elevated TSH and low free T4 indicate that the current dose of levothyroxine is insufficient. The appropriate next step is to increase the dose. Switching to liothyronine is not typically recommended, as it is not more effective than levothyroxine. Thyroid ultrasound is not indicated in this case, unless there are nodular findings. Question 6. A patient presents with exophthalmos, weight loss, and elevated heart rate. Lab results show low TSH and high free T4 and T3. What is the most likely diagnosis? A. Graves' disease. B. Hashimoto's thyroiditis. C. Subacute thyroiditis. D. Thyroid cancer. Answer: A. Graves' disease. Rationale: the combination of low TSH, high free T4 and T3, and symptoms such as exophthalmos and weight loss is characteristic of Graves' disease, an autoimmune condition causing hyperthyroidism. Hashimoto's thyroiditis typically presents with hypothyroidism, and thyroid cancer does not commonly cause hyperthyroidism or exophthalmos. Question 7. In a patient with hypothyroidism, what lab result will be most concerning when starting levothyroxine therapy? A. Elevated free T3. B. Elevated potassium levels. C. Decreased hemoglobin levels. D. Elevated heart rate at rest. Answer: D. Elevated heart rate at rest. Rationale: elevated heart rate at rest could indicate an underlying cardiac issue or an overactive response to levothyroxine. Potassium and hemoglobin levels may be affected by hypothyroidism, but they are not as critical for dose adjustment of levothyroxine. Elevated free T3 is more indicative of hyperthyroidism. Question 8. A 28-year-old woman with a history of hyperthyroidism now presents with fatigue, constipation, and hair thinning after treatment with radioactive iodine. What should be monitored most closely? A. TSH and free T4. B. Complete blood count, CBC. C. Calcium and phosphorus levels. D. Liver function tests. Answer: A. TSH and free T4. Rationale: after radioactive iodine treatment, it is crucial to monitor TSH and free T4 levels to detect hypothyroidism, which can develop after treatment. CBC, calcium, and liver function tests are not as critical in this situation. Question 9. A 50-year-old woman with hypothyroidism presents with dyspnea, bradycardia, and cold extremities. Labs show TSH greater than 50 and low free T4. What is the most likely cause of her symptoms? A. Myxedema coma. B. Pulmonary embolism. C. Heart failure. D. Thyroid storm. Answer: A. Myxedema coma. Rationale: myxedema coma is a severe, life-threatening complication of hypothyroidism, presenting with signs of systemic slowdown, bradycardia, cold extremities, and severe laboratory abnormalities, very high TSH, low T4. Pulmonary embolism and heart failure are less likely given the context of untreated hypothyroidism. Question 10. In the management of thyroid storm, which of the following interventions should be prioritized to prevent cardiovascular collapse? A. Administer antithyroid drugs, methimazole or PTU. B. Provide cooling measures to control fever. C. Administer beta blockers to control heart rate and prevent arrhythmias. D. Administer intravenous corticosteroids. Answer: C. Administer beta blockers to control heart rate and prevent arrhythmias. Rationale: beta blockers, e.g. propranolol, are essential for controlling the tachycardia and arrhythmias that often accompany thyroid storm, while antithyroid drugs, cooling measures, and corticosteroids are all part of the management. Stabilizing the cardiovascular system takes precedence. Question 11. Which of the following symptoms is most indicative of a thyroid crisis in a patient with a history of hyperthyroidism? A. Severe anxiety and restlessness. B. Severe bradycardia and hypotension. C. Diarrhea and weight loss. D. Decreased deep tendon reflexes and cold intolerance. Answer: A. Severe anxiety and restlessness. Rationale: thyroid crisis, thyroid storm, is marked by acute manifestations of hyperthyroidism, including severe anxiety, restlessness, fever, and tachycardia. Diarrhea and weight loss are common in hyperthyroidism, but they are not signs of crisis. Bradycardia, hypotension, and cold intolerance are indicative of hypothyroidism. Question 12. What is the most important consideration when starting thyroid replacement therapy in elderly patients? A. Begin with a higher dose of levothyroxine. B. Monitor for signs of cardiac complications. C. Restrict fluid intake to reduce swelling. D. Avoid administering the medication on an empty stomach. Answer: B. Monitor for signs of cardiac complications. Rationale: elderly patients are at higher risk for cardiovascular complications, especially if they're started on too high a dose of levothyroxine. Cardiac monitoring is essential, as the treatment can exacerbate underlying heart disease. Starting with a lower dose is typically preferred in older adults. Question 13. A 40-year-old male presents with progressive muscle weakness, delayed deep tendon reflexes, and elevated TSH. His free T4 is low. What should be prioritized in his nursing care plan? A. Increase iodine intake through diet. B. Administer thyroid replacement therapy. C. Monitor for signs of thyroid storm. D. Recommend increased physical activity. Answer: B. Administer thyroid replacement therapy. Rationale: the patient's symptoms and lab results suggest hypothyroidism, which requires thyroid replacement therapy, e.g. levothyroxine, as a primary intervention. Iodine deficiency is not likely, and thyroid storm is a complication of hyperthyroidism. Increased physical activity is not appropriate until thyroid function is stabilized. Question 14. In a patient diagnosed with subclinical hypothyroidism, what is the primary consideration for initiating treatment? A. Symptomatic relief of fatigue and depression. B. Cardiac risk management. C. Normalizing TSH levels alone. D. Prevention of goiter formation. Answer: A. Symptomatic relief of fatigue and depression. Rationale: in subclinical hypothyroidism, treatment is typically initiated if the patient has symptoms such as fatigue or depression, even if TSH levels are mildly elevated. Normalizing TSH alone or preventing goiter is not always the focus, and cardiac risk management is not a primary concern unless there is evidence of cardiovascular disease. Question 15. A patient with hyperthyroidism has been prescribed methimazole. What is the most critical nursing intervention when monitoring this patient? A. Monitor for signs of jaundice or dark urine. B. Assess for thyroid storm. C. Encourage regular iodine supplementation. D. Monitor for signs of hyperkalemia. Answer: A. Monitor for signs of jaundice or dark urine. Rationale: methimazole can cause liver toxicity, so monitoring for jaundice or dark urine is crucial. Thyroid storm is an acute condition that requires immediate intervention, but it is not a direct side effect of methimazole. Iodine supplementation is typically not needed during methimazole therapy. Hyperkalemia is not a typical side effect. Question 16. Which of the following would be most concerning finding in a patient newly diagnosed with hypothyroidism who is receiving levothyroxine therapy? A. Sudden weight loss. B. Increased appetite. C. Chest pain and palpitations. D. Dry skin and brittle nails. Answer: C. Chest pain and palpitations. Rationale: chest pain and palpitations could indicate an overactive thyroid response to levothyroxine, potentially leading to arrhythmias or cardiovascular stress. Weight loss and increased appetite could be signs of hyperthyroidism, but they are not immediate concerns. Dry skin and brittle nails are common in hypothyroidism and are not urgent signs. Question 17. Which of the following is a critical aspect of patient education when initiating treatment for hyperthyroidism with radioactive iodine? A. Inform the patient that they will need lifelong thyroid replacement therapy. B. Advise the patient to maintain a high iodine diet to enhance treatment effects. C. Recommend immediate cessation of beta-blocker therapy after the first dose of radioactive iodine. D. Instruct the patient to avoid all forms of contact with others for at least 24 hours. Answer: A. Inform the patient that they will need lifelong thyroid replacement therapy. Rationale: after radioactive iodine therapy, most patients develop hypothyroidism and will require lifelong thyroid replacement. High iodine food should be avoided, and cessation of beta blockers should only be done under medical supervision. Limiting contact over 24 hours is not usually required. Precautions typically last about a week. Question 18. A patient with hyperthyroidism is admitted for thyroid storm. Which of the following interventions should be implemented first? A. Administer iodine solution to block thyroid hormone release. B. Administer high-dose corticosteroids to decrease thyroid hormone production. C. Begin cooling measures to reduce fever. D. Administer beta blockers to control heart rate and prevent arrhythmias. Answer: D. Administer beta blockers to control heart rate and prevent arrhythmias. Rationale: beta blockers should be administered first to control the cardiovascular effects of thyroid storm, particularly tachycardia and arrhythmias. While corticosteroids, iodine solution, and cooling measures are important, stabilizing the cardiovascular system takes priority. Question 19. A patient with a history of hypothyroidism is experiencing severe bradycardia, hypothermia, and confusion. What is the first intervention the nurse should implement? A. Administer levothyroxine. B. Provide warming measures. C. Monitor blood pressure. D. Administer intravenous corticosteroids. Answer: B. Provide warming measures. Rationale: in myxedema coma, hypothermia is a major concern. Warming measures should be initiated first to prevent further complications. Levothyroxine administration and corticosteroids may be used later, but the priority is stabilizing the patient's temperature. Question 20. A 35-year-old patient with hyperthyroidism has been prescribed methimazole. Which of the following side effects should the nurse be most concerned about? A. Increased appetite. B. Sore throat and fever. C. Diarrhea and weight loss. D. Tremors and insomnia. Answer: B. Sore throat and fever. Rationale: methimazole can cause agranulocytosis, a rare but serious side effect that manifests as sore throat and fever. This indicates a potential infection due to decreased white blood cell count and requires immediate discontinuation of the medication. Question 21. A patient with hyperthyroidism presents with severe weight loss, tremors, and irritability. What is the most likely complication of untreated hyperthyroidism? A. Myxedema coma. B. Osteoporosis. C. Acute renal failure. D. Thyroid storm. Answer: D. Thyroid storm. Rationale: thyroid storm is a life-threatening complication of untreated hyperthyroidism, characterized by severe symptoms such as weight loss, tremors, and irritability, in addition to fever, tachycardia, and altered mental status. Question 22. A 60-year-old female with hypothyroidism is being started on levothyroxine therapy. What should the nurse assess before initiating the medication? A. Cardiac history and potential arrhythmias. B. Renal function and electrolyte levels. C. Liver function tests. D. Complete blood count, CBC. Answer: A. Cardiac history and potential arrhythmias. Rationale: levothyroxine can increase the heart rate and exacerbate underlying cardiovascular conditions, especially in elderly patients. Therefore, cardiac assessment is critical before initiating therapy. Renal function and CBC are less critical unless other symptoms are present. Question 23. A patient presents with an enlarged, non-tender thyroid gland and a history of fatigue, constipation, and weight gain. What is the most likely diagnosis? A. Hyperthyroidism. B. Hashimoto's thyroiditis. C. Thyroid cancer. D. Graves' disease. Answer: B. Hashimoto's thyroiditis. Rationale: Hashimoto's thyroiditis typically presents with an enlarged, non-tender thyroid gland and symptoms of hypothyroidism, fatigue, constipation, weight gain. Hyperthyroidism and Graves' disease are associated with a different set of symptoms. Thyroid cancer usually does not cause diffuse enlargement. Question 24. A 55-year-old patient with hyperthyroidism develops severe tachycardia and is admitted to the ICU. What is the most appropriate immediate action? A. Administer an iodine solution. B. Administer beta blockers to control heart rate. C. Initiate corticosteroid therapy. D. Administer an antithyroid medication, e.g. methimazole. Answer: B. Administer beta blockers to control heart rate. Rationale: beta blockers, e.g. propranolol, are used to control the heart rate and prevent arrhythmias in thyroid storm. Antithyroid medications and iodine solutions are also part of management, but are secondary to controlling the cardiovascular effects. Question 25. A 45-year-old woman with newly diagnosed hypothyroidism presents with symptoms of depression. What is the best course of action? A. Refer the patient for psychiatric evaluation. B. Start levothyroxine therapy and reassess depression symptoms in a few weeks. C. Start an antidepressant medication. D. Recommend counseling and stress management techniques. Answer. B. Start levothyroxine therapy and reassess depression symptoms in a few weeks. Rationale. Depression is a common symptom of hypothyroidism. Starting levothyroxine therapy should improve both the thyroid function and associated depressive symptoms. Psychiatric medications or referrals should be considered only if the symptoms persist after thyroid replacement therapy. Question 26. A 38-year-old male with hypothyroidism is started on levothyroxine. What is the most appropriate method to assess the effectiveness of this therapy? A. Monitor for signs of thyroid storm. B. Measure TSH levels periodically. C. Monitor heart rate and blood pressure. D. Perform a thyroid ultrasound. Answer. B. Measure TSH levels periodically. Rationale. TSH levels are the most reliable indicator of thyroid function and the effectiveness of levothyroxine therapy. Heart rate and blood pressure should be monitored for potential side effects, but TSH levels provide the best assessment of therapy efficacy. Question 27. What is the most appropriate intervention for a patient who presents with a sudden increase in symptoms of hyperthyroidism after initiating radioactive iodine therapy? A. Increase the dose of methimazole. B. Administer iodine solution to block thyroid hormone release. C. Monitor for thyroid storm and provide supportive care. D. Start corticosteroid therapy immediately. Answer. C. Monitor for thyroid storm and provide supportive care. Rationale. After radioactive iodine therapy, the patient may experience a temporary worsening of hyperthyroid symptoms due to the release of stored thyroid hormones. This can lead to thyroid storm, which requires immediate monitoring and supportive care. Question 28. Which of the following lab findings would most likely be seen in a patient with subclinical hypothyroidism? A. Low TSH and low free T4. B. Normal TSH and low free T4. C. Elevated TSH and normal free T4. D. Low TSH and high free T4. Answer. C. Elevated TSH and normal free T4. Rationale. Subclinical hypothyroidism is characterized by an elevated TSH level with normal free T4 levels, indicating early thyroid dysfunction before overt hypothyroidism develops. Question 29. A 25-year-old woman is diagnosed with Graves' disease. What is the most appropriate long-term treatment? A. Methimazole and beta blockers. B. Thyroidectomy. C. Radioactive iodine therapy. D. Levothyroxine therapy. Answer. C. Radioactive iodine therapy. Rationale. Radioactive iodine is the most common long-term treatment for Graves' disease, as it targets and destroys the overactive thyroid tissue. Methimazole is used in the short term, and beta blockers control symptoms. Thyroidectomy is considered when other treatments fail. Question 30. What is the most common complication associated with untreated hyperthyroidism in older adults? A. Heart failure. B. Hypercalcemia. C. Osteoporosis. D. Myxedema coma. Answer. C. Osteoporosis. Rationale. Untreated hyperthyroidism accelerates bone turnover, leading to osteoporosis, which is a significant complication in older adults. Heart failure and hypercalcemia can occur with hyperthyroidism, but are less common. Myxedema coma is associated with hypothyroidism, not hyperthyroidism. Question 31. Which of the following is a primary cause of myxedema coma? A. Overtreatment with levothyroxine. B. Untreated or inadequately treated hypothyroidism. C. Acute hyperthyroidism. D. Iodine deficiency. Answer. B. Untreated or inadequately treated hypothyroidism. Rationale. Mixed edema coma is a life-threatening condition that occurs as a result of severe, untreated hypothyroidism. It can develop after a prolonged period of inadequate thyroid hormone replacement. Question 32. Which of the following is a contraindication for radioactive iodine therapy in a patient with hyperthyroidism? A. Age greater than 60. B. Pregnancy or breastfeeding. C. Use of beta blockers. D. Elevated TSH levels. Answer: B. Pregnancy or breastfeeding. Rationale: radioactive iodine is contraindicated in pregnancy and breastfeeding due to the risk of harm to the fetus or infant. Beta blockers and elevated TSH levels are not contraindications for radioactive iodine therapy. Question 33. A patient with hyperthyroidism is prescribed methimazole. Which of the following should the nurse include in the patient's education? A. Increase iodine-rich foods in your diet. B. Avoid close contact with pregnant women and children. C. Report any signs of infection, such as sore throat or fever. D. Stop the medication if you experience weight gain. Answer: C. Report any signs of infection, such as sore throat or fever. Rationale: methimazole can cause agranulocytosis, which leads to a decreased white blood cell count and increases the risk of infection. The patient should be educated to report signs of infection immediately. Question 34. Which of the following is the most common cause of hypothyroidism in the United States? A. Iodine deficiency. B. Hashimoto's thyroiditis. C. Subacute thyroiditis. D. Thyroidectomy. Answer: B. Hashimoto's thyroiditis. Rationale: Hashimoto's thyroiditis is the most common cause of primary hypothyroidism in the United States, an autoimmune condition where the body attacks the thyroid gland. Iodine deficiency and subacute thyroiditis are less common in developed countries. Question 35. A 65-year-old patient presents with increased appetite, weight loss, and anxiety. Lab tests reveal low TSH and high free T4. What is the most likely diagnosis? A. Hyperthyroidism due to Graves' disease. B. Hyperthyroidism due to thyroid cancer. C. Subclinical hyperthyroidism. D. Hypothyroidism. Answer: A. Hyperthyroidism due to Graves' disease. Rationale: low TSH and high free T4 levels, along with symptoms of increased appetite, weight loss, and anxiety, are classic signs of hyperthyroidism due to Graves' disease. Thyroid cancer typically does not cause hyperthyroidism or anxiety. Question 36. A patient with a history of hyperthyroidism presents with leg weakness, increased muscle mass, and slow reflexes. What condition should be suspected? A. Hypercalcemia. B. Osteoporosis. C. Hypokalemic periodic paralysis. D. Adrenal insufficiency. Answer: C. Hypokalemic periodic paralysis. Rationale: hypokalemic periodic paralysis is a rare complication of hypothyroidism, presenting with sudden muscle weakness, often triggered by high carbohydrate meals or rest. The muscle mass increase and slow reflexes are unusual, but the weakness and potassium imbalance are key indicators. Question 37. A 45-year-old woman with hypothyroidism is admitted for an elective surgery. What is the most important action for the nurse to take preoperatively? A. Hold the levothyroxine dose for the day of surgery. B. Administer levothyroxine before surgery. C. Check TSH and free T4 levels. D. Ensure that the patient is well hydrated and warm. Answer: D. Ensure that the patient is well hydrated and warm. Rationale: prior to surgery, patients with hypothyroidism may experience a risk of hypothermia and fluid imbalances. Ensuring proper hydration and maintaining warmth are crucial to prevent mixed edema coma. Question 38. A patient with hypothyroidism is started on levothyroxine therapy. Which of the following is a critical monitoring parameter during therapy? A. Blood glucose levels. B. TSH and free T4 levels. C. Serum calcium levels. D. Liver enzymes. Answer: B. TSH and free T4 levels. Rationale: TSH and free T4 levels are the most critical parameters for monitoring the effectiveness of levothyroxine therapy. Blood glucose and liver enzymes are not directly related to thyroid function, and calcium is not typically affected by thyroid hormone replacement. Question 39. A patient presents with a history of hyperthyroidism, exophthalmos, and a goiter. What is the first-line treatment? A. Methimazole. B. Radioactive iodine therapy. C. Thyroidectomy. D. Beta blockers. Answer: B. Radioactive iodine therapy. Rationale: radioactive iodine therapy is the first-line treatment for grave disease, the most common cause of hyperthyroidism, which includes symptoms like exophthalmos and a goiter. Methimazole is used initially to control symptoms, but is not the long-term solution. Question 40. What is the best initial approach for managing a patient with thyroid storm? A. Administer high-dose corticosteroids. B. Administer an antithyroid medication immediately. C. Provide cooling measures. D. Stabilize the cardiovascular system with beta blockers. Answer: D. Stabilize the cardiovascular system with beta blockers. Rationale: the most immediate concern in thyroid storm is stabilizing the cardiovascular system by controlling tachycardia and preventing arrhythmias with beta blockers. Cooling measures and corticosteroids are important but secondary interventions.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.